Hey everybody, I just want to go over kind of the basics of how to use the Voodoo band to kind of help with inflammation, especially in the knee. I mean, it can be used for any body part, but basically what you're doing, it's not like anything too complicated. It's not trying to make it too, but the idea is that you do want to wrap the whole area. So, you know, you get these bands and, you know, a lot of times I supply them for people who are coming in here, but also it's a good amount of pull here. What you do, you hold here and you get kind of low below the knee, okay? And then you want to pull it, and you can kind of look here, but basically I'm just trying to get some leverage on it. And you can do this yourself, right? So I pull on here and then go across, and then I'm kind of doing some overlap, and I'm getting some stretch on that tissue. So my knee's a little bit bent and a little bit straight, but I'm kind of working myself up, okay? So I'm going up and through here, and you're going to feel some, you know, the blood vessels kind of, you know, constricting a bit. That's kind of the whole idea, working it around. However you need to maneuver yourself is kind of the whole idea, is just kind of figure out how it works to get you in a position. What I'm then doing is working my way from the foot up towards the heart, you know, give myself some good compression, find those spots, you know, and basically just tacking all this tissue down, so just helping it move a little better. It's a little hard sometimes with that leg here, but you just do your best, get up through here, and then go all the way to the end, and you got to kind of plan for when you got to tuck it in, right? So once you get here, and probably if I did this again, I might move it up a bit, but the idea is just to have some good compression there. You don't have to be perfect with any of this, because it's only going to be on for a couple minutes. Then you lap it in, you kind of hold there like that. And what you're going to do is then be as active as you can. So you're going to then get some knee flexion, knee extension, work it out a little bit, all the way up, all the way down. You might have also do some little knee bends. So you get on here, you're just doing your little air squats, getting you further down. Maybe you're getting into some lunging and kind of holding here like this. It gets pretty compressive in the back. You just kind of find out what you can do the best you can, but you're adding in some flexion extension, just kind of moving it. Maybe even just do some single legs. Basically, the idea is to move through the range you best you can, you know, get as deep as you possibly can comfortably to work that out. So that's the whole idea with the Voodoo band floss. Do that for a couple minutes or so. It's probably been about about a minute or so since I finally got it on. And then you can kind of see it's getting kind of red here. You don't want to hold it till you get, you know, overly tingling into your foot, but you probably will feel a little bit of that, which is okay. And also make sure that you don't have any major vascular issues. That's kind of a big thing, or any blood clot things. Should be obvious that you don't do this, but use common sense. Don't overdo it at the beginning. If you're worried about that, ask your doctor if there's any other things we need to be aware of, like general practitioner. But the next thing is then take it off quickly, and then you can kind of look up close here. You can kind of see the tissue color, you know, goes from this kind of cadaverish body to just a good red flow here. You can kind of see how red it got, right? So the idea is that all of a sudden you constricted that blood flow, you move through that, you tack that tissue down, and that's all sweaty and red, which is good. You want the body moving as best you can. And it actually feels really good now. You know, I have a little bit of an issue with my front and my knee lately, but the idea is like just working that through the range, going through that a few times, and you can do this as often as you can. Do this instead of icing. Do this, like, get yourself moving. Find those hot spots, work on those. You can find and adjust it. Like for me, I said I started here. Maybe I move it up a little bit and work a little bit higher here. It also works in other spots and tendons and things like that. Maybe working on the ankle. I've done it with ankle. All sorts of areas that you can work on, but the Voodoo floss is a really helpful thing. It really, you know, I wasn't sure when I learned this. Dr. Kelly Starr is the guy who kind of made this popular, but basically I took it with like a little skepticism, but then I did it myself. Recommend you try it on your own and do this on a regular basis. I think you'll find some big payoffs with it. So hopefully that was helpful. Let me know if there's any questions. I'm happy to help. Thanks.